Brothers and sisters, this week, the coronavirus positive cases in this country surpasses 7 million. This is less than a month after reaching 6 million. And the good news is that in San Bernardino County, we are in the red zone, but we are not in it long enough to enjoy all the benefits. That in the next coming days or weeks, we will be able to enjoy the benefits that come with being in the red zone. Having said that, there are a number of misconceptions about coronavirus that is going around.
For the last 9 months, the world has slowly been learning about a disease that didn't even exist a year ago. But there are still a lot of misconceptions about COVID-19.
Now we know it. It affects elderly people with heart problems.
Misconception number 1. Only older people are affected by this virus. Fact is, everyone's been impacted in some way by the virus. While older people are much more likely to die if they're infected, younger people are by no means immune. There have been over 840 COVID-19 related deaths in young people under the age of 30. At least 850 children, 17 and younger, have been hospitalized, like 12-year-old Juliet Daly.
It felt like my legs were kind of really weak, and I was pretty tired.
She started having blue lips.
With younger people like Juliet, it could be that their immune systems reacted too strongly, creating this cascade of inflammation, a cytokine storm. In kids, this condition is known as multi-system inflammatory syndrome in children, or MISC. In older people, it could be that their immune systems are too weak. But whether you're young or old, survivors also have something else to worry about. Their symptoms may linger and persist much longer than we first realized. In fact, those patients even have a name now. They are called the long haulers. Misconception number 2. Masks don't offer any protection against the coronavirus. You may have seen an image like this in your social media feed. But the truth is, once we learned that people could spread the virus, even if they had no symptoms, masks became a must. Some studies have found that masks can reduce the amount of droplets that you breathe out by up to 90%. Take a close look at this video. This is without a mask. Now with a mask, you can see how many fewer droplets are being expelled. And a surgical mask has something else. Electrostatically charged fibers that can grab viral particles, kind of like a blanket will grab your socks in the dryer. Misconception number 3. You can only catch COVID-19 if you've been in close contact with someone who actually has symptoms. You remember that choir in Washington State? Out of 61 members, there was only one symptomatic person. After 2.5 hours of singing, 87% of the participants became infected. It was early evidence that the virus could spread not just through touch or through respiratory droplets, but through something known as aerosols. Think of those as suspended viral particles, lingering in the air for a while, and also traveling much farther than 6 feet. Misconception number 4. Everyone will be able to get a vaccine this winter.
We'll have a few million in November and maybe 10, 20 million of each in December. That would be enough to vaccinate certain populations.
Truth is, while everyone is hopeful, we're still not even sure if the vaccine's going to work, and no one has yet seen all of the data. If a vaccine is authorized for emergency use, first people to get it are likely going to be healthcare workers and particularly vulnerable individuals. But for the rest of the general public, it's looking more like the middle of 2021. There's still a lot we need to learn, but we need to stay focused on what science tells us can help us overcome this now. I'm as excited as anyone about the prospects of a vaccine. But in the meantime, there are simple and very effective things we can do ourselves to change the trajectory of this pandemic. Wash our hands, avoid large gatherings, wear a mask.
We are resuming our outdoor services. So tonight at 5 p.m., we will start our service on the lawn. Note the time change. Before we used to meet at 6:30, and from today, we are starting our services at 5 p.m. I hope to see you there. Have a great Sabbath.